What's up, everybody? Welcome to episode 53. My name is Katie Kleber, and I am your host for the unofficial NCLEX podcast. This episode is titled Ensure Proper Identification of Patients When Providing Care. So, this is basically saying you got to make sure you're doing the right care on the right patients, and you have to identify them before you go do care. So I was trying to think if there is another way that patients are identified other than an armband, and I honestly cannot think of one. Most patients have an armband on, and I also have had the situation where I have had patients that are bilateral amputees, so they can't put an armband on them, so they'll put them on their leg, maybe. But I truly, other than that, I don't know, and you have infants, they're on their foot, but I can't think of another identification thing. So most of these patients will have their ID band, and it will have a barcode on it, and their name and their birthday and medical record number, and maybe an encounter number. So before you provide care, so it's not just medication, but, removing a Foley, providing a bed bath, providing education, you want to make sure you're dealing with the right person. And this is necessary because, especially when you're working with more than a couple patients, it's real easy to get patients confused, especially if maybe you're working on your patient and you're delegating maybe to a CNA to remove a Foley catheter. You must make sure that you're giving appropriate delegation, and that person is using appropriate identification to make sure that the procedure is done on the correct patient. So, I work in neuro, so frequently I'm asking patients to tell me their name and birthday anyway, but if they're able to answer this, you want to ask them their name and their birthday before they give any medications. Or, I don't want to say specifically name and birthday. Maybe, the hospitals typically say 2 patient identifiers. So whatever that may be. So it's not, because, you can have a couple patients with the same name. And a lot of hospitals will put up, name alerts if you have a couple patients that either have the same name or very similar names, and try to separate those nurses to prevent errors from occurring. But many facilities now with electronic healthcare records require armband scanning before giving any medication. So this is also another safeguard that is wonderful. Hey, I'm going to give Mr. Smith some Zofran. Can you tell me your name and birthday? Yes, John Smith, 2/22/1954. Great. And then I scan the wristband and it tells me, yes, this is the correct guy. So you want to make sure that you're doing that because you want to prevent errors. And I'll give you an example. Let's see, I have, if you're delegating to a CNA, like I said before, to discontinue a Foley catheter, and you say, hey, can you go discontinue the Foley catheter on bed 2? But maybe you meant Mr. Smith in bed 4, not Ms. Johnson in bed 2, but the CNA heard bed 2. And if the CNA just goes in and does that, and doesn't verify an order, verify a name, you're removing a catheter on a patient that should not have it removed. And what if that patient had the catheter placed in the OR and it had to stay? That could be such a big deal. So you want to make sure that you're communicating appropriately when delegating care, and always ensuring appropriate identification of the patient when providing the care. And I know this sounds really obvious, but when you are in the thick of it and you've got a report on 5 patients and you're discharging 2 of them and you're getting 2 of them back, and it's 5 p.m. and you're looking at the patient who are you again? I can't remember your name, and I've been here for 10 hours. It is important to do this every time, so you're systematically, before you're given meds, what's your name and your birthday? What's your name and your birthday? What's your name and your birthday? Scan the wristband. Absolutely essential. So this concludes episode 53. The title again of this episode was Ensure Proper Identification of Patient When Providing Care. Thank you so much for listening.
This has been another episode of the unofficial NCLEX Prep podcast. To get the massive PDF guide that goes along with this podcast, head over to nrsng.com/NCLEX-Prep. That's nrsng.com/NCLEX-Prep. That's a free download that you can take with you anywhere, and you can basically have this podcast in text format. Our goal here at NRSNG.com is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. We want you to succeed, and we want you to become part of this movement of nurses that is dedicated and motivated to learning and becoming the best nurse that they can possibly be. My name is John Haas, RN CCRN, and I'm the founder of NRSNG.com, and I sincerely thank you for being here, and I'm so proud of you for taking this step in your journey. Now you know what time it is now. It's time to go out and be your best self today. Happy nursing.